Good morning, everybody. It is Dr. Pearlman, and I've got another video for you here today because I'm sort of revamping the channel. I don't know if you've noticed, making a few more videos in the last few weeks. Obviously, it should be very obvious to everybody why I was off for so long, or kind of the evolution or de-evolution or lack of progression on the channel. It should be very obvious to everybody, and if you don't know by now, hint, hint, it's the back surgery, and we'll let you use your wildest imaginations as to understand as to how that could have potentially kept me kind of occupied. Well, anyways, I just put out a video about acceleration of healing, but what I want to do is make a all-encompassing video this morning of how you can kind of take care of yourself at home, aka another home exercise video, because I think there's a real lack of understanding of just like what to do, when to do, how to do. So let's just assume and jump right into this. A lot of people that see a chiropractor, they see chiropractor for back pain. Maybe neck pain, but chiropractic, back pain. Overall, you should see a chiropractor for any type of dysfunction or pain that you have, period. And if you don't know by now why that is, it's pretty much the most accessible, that's right, most accessible, probably most affordable, and most effective based on the proper stimulation at the proper time to start to feel good. The stimulation to the brain is a nervous system thing. It's not just a joint pain. Yes, there is some symptom management associated with while we're trying to find the underlying cause and working with your doctor, hopefully more of a concierge service where your doctor and you can build a good relationship, have a good rapport, ask a lot of questions to be able to sort of get to the bottom of what's going on with your health if there is a greater concern than just the obvious mechanism of injury, joint pain. But without me going down a rabbit hole, what do you do to kind of take care of yourself? Well, I'm going to show you a few things you should be doing at home to take care of this back pain type of stuff. And one of the first things you do is put your dog gently on the floor, and you end up doing what I call tummy time. And that is to decompress your spine by simply laying here like this. Now, some of the things that happen when you do spinal decompression like this is you might feel some back pain because you're in what they call extension, right? So here's Dr. Axel trying to do some chiropractic, but let's just say you're in extension. This is lumbar extension. Well, you don't have to go into forced extension. You can just lay here like this. Another thing is, once we get Axel out of the way here, laying on your stomach. Careful, buddy. All right, so laying on our back now. I know the camera's picking this up. So while we're laying on our back, we're decompressing, especially when our knees are bent, because it decompresses or offloads the facet joints in the bottom of the lumbar spine. So what's one of the first things we can do is the doctor recommended glute bridge. So doing a proper glute bridge where you're not just thrusting up, but you're actually drawing the pelvis sort of up to the ceiling, but a little behind you. So you're actually trying to point your pelvis, your pubic symphysis down here where no one should ever touch you in the office. It's a draw up. So you're drawing up. So you want to kind of trap your hands below your back like they talk about. A proper anterior pelvic tilt or reversing an anterior pelvic tilt would be this kind of contraction of these iliacus muscles, they're called. Drawing that in, flattening the back here, and then drawing up slowly. But the key is to push your heels out and away. So you're pushing your heels away and out, like this. Out and away, out and away. So then, once you've completed that by activating the glutes and sort of decompressing your back in the first two exercises I show you, you roll to your side, and you practice what's called the side bridge. And this is one of the McGill Big Three. If you don't understand what I'm saying, it's Stu McGill, McGill Big Three. Up and forward. Up and forward. You really want to feel the oblique and the bottom glute medius. Boom, up and forward. You do both sides. Matter of fact, I'm going to do both sides. You got to get some space. Up and forward. Up and forward. Very important exercise. Stimulating glute activity, strengthening the core. Remember, the core isn't about doing sit-ups. I actually think sit-ups are stupid for people with back pain. And the reason I'm saying that is because anytime you do a crunch or a chin-up or a sit-up, sorry about the microphone, guys. When you're doing sit-ups, you are putting tension on the back by increasing intrathecal pressure. When you flex forward and increase pressure in your core, that's when the disc wants to go pop or the stenosis wants to go and be irritated. It's a good way to exacerbate back pain. Usually that will work best after you've been adjusted because that increased range of motion and allows you to go a little bit closer to like beyond anatomical integrity. By the way, that's how you get hurt, is going beyond anatomical integrity and compromised position. Then you need to see me for a whole bunch of sessions. But again, it should all start to make sense if you're actually listening to the words that I'm saying and showing you certain motions. Another thing you can do at home is a proper hip hinge. So one of the things that I like to show my patients is just simply trying to close the drawer behind you. So it's a pushing your butt back. Oh my God, no way. Butt back, knees out. Butt back, knees out. You're just pushing your knees out a little as you put your butt back. Now, when you're acutely injured with lower back pain, this could end up being something that hurts in the beginning, so you don't do it. But you begin to progress with a proper hip hinge, which turns into a hip hinge squat. Hip hinge squat. If you can't do this effectively, you won't be able to use the toilet for the rest of your life. So be very good at hip hinge. Butt back, knees out. Key to coming up out of this position is not squatting like they teach you in the gym. You never want to look up at a piece of tape and rise straight up. It is always shoulders slightly forward, butt back, knees out. Shoulders slightly forward, butt back, knees out. You're loading your glutes and hamstrings, taking pressure off your lumbar spine. Get good at it. One of the other things we can show you is you can take a foot roller of sorts, a little golf ball is fine. Now you probably can't see, but I'm putting this on the floor and I'm rolling out the fascia, right? Plantar fasciitis, we've all been familiar with that term, on the bottom of the foot. You just want to mash and massage the bottom of your foot gently. You don't want to overdo it. You don't want to make this hurt. You probably can't see this right now, but I'm just rolling the bottom of my feet. Are the feet the most important part of the body because it all starts down there and the forces come up? No. Every part of the body is the most important part of the body, okay? Just get used to understanding and owning that. Every part of the body is the most important part of the body. Gonstead chiropractic, foundation principle. Everything starts in the foundation, the pelvis, the SI joint, the sacrum, the lumbar. Guess what? Every part of the body is the most important part of the body. Roll out the feet. Okay, there it is. I just bent to pick this down, butt back, knees out. Now, what about this, reaching forward? I'm going to show you one last thing. I'm going to cut off the video. One of the most important things you can do for your body, as Dr. Axel wants to play, is you have to do what we call progressive motion. Now there's active progressive motion and passive progressive motion. In the beginning, to get over acute injuries, you will want to use passive progressive motion, but let's assume you can do active progressive motion here. You have to be able to tolerate, to get over some back pain, that lower back tension from rounding forward. If you can never begin to accomplish feats like this in free range of motion, you're really not going to have the freedom you want to do like everything, which will eventually be something like, oh, I have a bad back. How do I come here, reach, pick up with no compromised back? How do I swing my golf club with velocity and never have a compromised back? That's something I was working with somebody recently with. How do I go to the tennis court, swing and rotate without having a compromised back? How do I go to the gym, power clean, clean and jerk, squat? How do I lunge, whatever, without that back pain? That's something that is really elaborated on if you work with me, maybe some of my trainers, which is Nicole and Morgan. You know who you are. Don't worry, girls, like, you are my trainers. I refer you patients. But that's one of the things you have to understand is that's that collaborative effort where you're working on progressive motion, corrective exercise, mobility, stability, protocol. That's putting in the work, and that goes beyond anything even in this video. But if you can't master some of the stuff in this video, why would you even bother trying to do that stuff? And if you do, you are going to be injured and you will spend more time in my office. And that's all good and great, right? That's why I go to work every day. But I really want to start to give you guys the tools to go beyond, oh, I'm always hurt. This is always hurt. Why is this always hurt? Which that's kind of the goal and the forwardness moving forward on this channel is we got to just start finding out why you're always hurt. How can you counter being hurt? I can show you videos of me cracking people all day, but I know YouTube loves it, and that's great. Maybe I will put a short up of someone getting adjusted, but there's not going to be long form videos of people getting consulted and adjusted. You're not going to see chicks in sports bras on my channel. You're not going to see dudes with six packs and being chiseled on this channel getting adjusted for clicks. We're going to take our pictures, we're going to upload our shorts like everyone else. But if you're not listening to the words I'm saying and you're not going to do the exercises I recommend, then you're never going to understand, and you're not going to advance in your sport or even just daily life of like normal activity without pain. And that's the goal here, okay guys? I want you advancing and feeling good, daily activity without pain, progressing, understand what it is you have to do. All right guys, I gotta get out of here. Dr. Pearlman. Right, Dr. Axel?